Today we're going to look at the Avea by CareFusion. This is the main panel here, and we're going to take a look at a few of the basic setup details. With the Avea, you're going to use a standard simple Y tubing, and you're going to connect it to both the in-story and ex-story ports of the ventilator. Okay, the pneumatic section of the ventilator is just below the screen, and we have the in-story, and so you have the in-story arrow going to the patient and the ex-story arrow coming into the ventilator. One thing I do want to point out is with the Avea, you have a heated HEPA filter. Now this HEPA filter maintains the vapor phase, or the vapor of the moisture, so it tends to not get clogged up as easily as some of the other ones. This is recleanable, or you can get disposable units. Also, you have a small water trap down here, which can be unscrewed if you have a lot of rain out, and that allows you to drain it away. And in here is a little ball valve, which allows you to take the cup off without losing gas while it's in use. That goes back on, screw it in place, make sure you don't screw up the threads, and then this goes in here, slides up, locks in place, and make sure that you have this pushed up into the machine and that the latch can hold it from dropping out. Okay, so the next step is let's hook up our ex-story and in-story tubing. How do we know in-story from ex-story? Always, when you have this temperature probe port, always put that on the in-story side of the ventilator, so that if you do go to a heated humidifier, you do not accidentally have the temperature probe sensing the ex-story flow. Okay, so with this ventilator, we're just going to use a HME, and we're going to place that right there, and that'll be our humidity for this ventilator. A couple things I want to point out here with the this ventilator, since we're close up here, is we have several different ports. We have an esophageal pressure line so that you can measure pressures internally in the patient and get better sense of auto PEEP and triggering and those type of things. You have an auxiliary connection. You have a flow, adult flow, and then also a neo flow. This machine is capable of ventilating neonates, but to do that you should use the little flow sensor that goes up at the patient's Y on the neo circuit, so that it can measure in-story and ex-story volumes and flows. And when you plug this in to here, even if it's on, running on the patient, this will automatically sense the neo sensor and switch the machine into the neo mode. We're not going to use this as a neo mode. We're going to now look at the ventilator. Oh, one other thing that I forgot to point out is there's a nebulized gas flow coming out here if you're not using the arrow chain. There's a nebulized port for gas nebulizers, and that'll can be activated, and your tubing can hook up onto there. Okay, so the first thing we're going to do, let's close in on this again and take a look. And when we plug this ventilator in, it's going to start to signify to you that it's powering. Okay, so we see here that we have the power and we have the charging of the battery. The battery will probably last about 1, maybe 2 hours if it's brand new. So it is possible for you to turn the machine on, but this will tell you that you're connected into your AC main power. Okay, now let's turn this machine around so that you can see the back side. The back side is also very interesting if you like interesting ventilators. Let's look at this. This right here is your power on off. As soon as you turn that on, the machine is going to start uploading its ventilation program. Okay, this is also your power, AC power in. Always with any ventilator, check, make sure this is plugged in, because you want, in some machines, this could result in being disconnected and causing some problems. In that you won't be connected to the AC. Down here is a connection that you can configure this machine to have a remote call alarm. They call it a nursing call, but that's okay. We have an O2 sensor here that will measure the gas that we're giving the patient, so we're getting accurate measurements. And then we have the air high pressure tubing, high pressure hose connection here, the DISS fitting, and then the oxygen DIS fitting as well. Now, one of the nice things with this machine is that you have a helium oxygen port, and as soon as you connect this to gas, turn it this way, it will begin to calibrate the machine on helium oxygen measurements, so that you will get accurate helium measurements. Okay, so we're going to turn this on by flipping up our little latch, and I'm going to turn it back around this way so you can see what happens when I turn it on. Okay, and we're going to turn it on. And it automatically goes into the alarm and load up. Okay, we have a little alarm going off, so let's silence that. Okay, and up here, let's close in on that. Okay, we have resume current patient or new patient. Let's go with new patient, and we can hit it again. We can hit. Okay, we have now a selection of adult, pediatric, neo. We want adult, so we're going to accept that size. And now we have each of the different areas of information that we can put in. We can put in the tube size, the tube length. We can turn on leak compensation if we have problems with a cuff or some other device. We also have a humidifier. We can turn that on and off. We're going to turn that off. And we can put in the patient's weight. So we're just going to rotate the knob down here. Let me show you. Okay, so we have this knob, and we can change the setting on the by rotating the knob. And let's see. And so let's go with a 70 kilo patient. We could put in an identification number if you want. Then we could go into the ventilator settings. But first, let's take a look at the EST. Okay, so we're going to remove the patient. We do not have the tubing on the patient, and then we're going to block the Y. Now, if this is a real patient that I'm going to use it on, of course I would have a gloved hand. Then I'm going to press continue, and it is going to count down, and that's as fast as the EST takes. It does not take very long. We have passed the leak, passed the tubing compliance, but we did fail the oxygen sensor, and that's because we are not on gas supply right now. We're using the internal compressor to deliver the volume, so that's fine. We're not going to worry about the O2 sensor, so we're going to continue. And we have the information we want. We can then go down here to the respiratory rates. Let's move that down. Okay, now we could go to the respiratory rate, touch it, rotate our knob down here to change the setting. Okay, let me just move this a little bit more so that you can see what's happening. So we can touch the setting, rotate our knob, and change our rate. And when we get it to the rate that we want, all we have to do is press accept, or we can press that element again. Same thing with tidal volume. If we want to go with smaller tidal volume, and we can press accept because that might be easier. Now we also have liter flow, we have in-story pause, we have PEEP, we have in-story trigger. We're on liters per minute, so that's a flow triggering, and we have our FiO2. Now, same loss of oxygen, so let's go up there and turn that down to 21. And that will make the oxygen happy. And now we're going to go into our alarm limits by pressing, let's see, okay, now we have everything set up. We like what we've set for the ventilator, so we're going to just simply go with setup, accept the setup, and I'm going to put it on a ventilator, on a test lung to ventilate. And now we are in a operational mode. Okay. Now, we see up here we're getting a high pressure alarm. So let's go into our alarm settings. Right here. We get this nice little orange box of all the settings. Well, our high pressure alarm, and you can change the placement of these depending on what you prefer, but right here is the high pressure. Okay, so our pressure is 32 and our high pressure limit is 40. That's about 10 above, but let's be really accurate and go to 42. Okay. High respiratory rate, we're doing 10. 75 is quite high, so let's bring that down to like 20. Low minute volume. One of the things I don't like is to have the minute volume at 0. We're ventilating at 450. Let's just increase this to like a nice number. You could go half of what it is or greater. Some places go with 100 mLs less. So let's just turn that to like 300. That'll make everybody happy. And now we can go to our high tidal volume. So what we want to do is, if the patient's starting to breathe, it's going to signal to us, and it's set at 3 liters, which is a little bit hefty. So let's bring this down to something reasonable. And let's say if we get a tidal volume of 600, that's going to be excessive. Okay, and low minute ventilation. Now we can calculate our minute ventilation right here. It gives it to us 4.5, which is 10 times 4.50. So let's go with low. I like it about 25%. We can go with let's say 3. Let's go with 3 liters, okay? Now this being in a very slow volume control mode, it may not be totally reflective. And then we have a high minute ventilation. So let's go with 25% more. So let's go with 6. We'll just go with a nice easy number, 6 liters. We have a low peak pressure. I like to go 10 less, and so our peak pressure is 31. Let's go with 20. That'd be fine. We have our high peak set. Low PEEP, we have PEEP of 6. That's good. Usually about between 5 and 10, but we're at 6, so 3 is fine. And then apnea interval of 20-second apnea is pretty acceptable. Okay, so we're happy. Let's press that, and now we're into the ventilation mode. So we have all of those things set, and we can do a few things. We can have an extra ventilator breath on the side there. We can go into suctioning, which will change the FiO2, which will give it 100%, but it will also change it so that when you take the patient off of the ventilator to do open suctioning, it won't give this gush of air and spray you in the face with the patient's moisture and secretions. Or you can go to increase FiO2 with some patients, like neonates. You don't want to go from 30% oxygen all the way up to 100%, but maybe you want to only go up to 40 or 50. Well, you can preset that amount so that you don't over oxygenate a patient and really mess up their status. Okay, so these are little action buttons: alarm silence, alarm reset, alarm limits. Then on this side is all of our nice little screens. Okay, and this gives us more information. Main always brings us back to this point. So just remember, if you want to get back to this screen, you press main here or touch the main up there. and we'll get back to that. Okay, so this gives us some basic information. You want to see different screens, you want to see what's available. Well, as I showed you,